Good afternoon. We are friends here. I'm your colleague. Friends, I'm Dr. Prakash, Garud, a cancer surgeon. But what today we are going to see, we are traveling in the same cart and we are going to see the odyssey of the future in cancer, future in oncology. So that's how we are here today to discuss and to know the future in cancer. Cancer is an important disease and it's concerned with the life of the patient, of the person itself. So it's very important and everyone should know what is cancer and how to prevent the cancer, how to treat the cancer, and what is the future in cancer is very important. I came from a village, a small story about me. I came from a small village in Maharashtra where there was no school after the 7th standard. But our teachers were very good. They were very passionate and they taught us that you should do something in the life. And when after the 7th standard, I was shifted my parents to the bigger city like Pune. And then I studied my high school education and there I completed my high school education and then there while my SSC I was doing, there was an essay and I returned an essay that I want to go to the medical profession. And that idea came into my mind and remained in mind throughout. So when completed my SSC, I went to joined the college, a college in Pune itself, that is a Ferguson College, and where I did my pre-degree and the FY, and then I was selected for the medical education in Mumbai, that is a JJ Hospital. So where we have been taught many things about the medicine, the basic things in the medicine. I completed my MBBS there and then I did my Master of Surgery also in the same institute. And while doing that, I was exposed in one department to the cancer surgeries, head and neck cancer surgeries. That department was very passionate about the cancer. And there I developed a passion for the cancer and decided to do the super specialty in cancer. And after completing my MS, I applied to the world-known institute, the Tata Memorial Hospital, applied there and I got selected for this cancer surgery as a super specialty. And there, so many teachers are there and so many surgeries that we did and so many people we met that we came to know how important that it is to give the treatment, give the early diagnosis, how important it is for the saving of the life of the patient. And you all should know it because it is the future. We want to know the future. We want to save the life of the patients. This is our board. Tata Hospital body, managing body with the director of the Tata Hospital is Del Prapul Desai and the other directors and all my colleagues and all our colleagues are doing well all over the India. Coming to the oncology, the incidence of the oncology incidence is very high. The commonest cause of death is the heart diseases and the second comes the cancer. But the cancer is increasing so fast that it might come that in the future that the cancer might come the first cause of death. That's why we have to be careful, we have to be aware about this cancer. Considering the India compared with the rest of the world, in India the head and neck cancers are more common because 2 million kgs of the tobacco is sold in India every year. And that is the problem because this affects our body, affects our cells and it produces the cancer. I moved 12 countries in the world, but I never found apart from India the tobacco shops because I specially searched for it, never found. But India, everywhere it is available and that is the problem. What is the status in India that 20 million cancer patients are there and every year new cases are detected. In 2022, the 14 million cases has been detected, 14 lakhs cases has been detected every year. So that's how the cancer is increasing and it's surpassing the world takeover, world statistics, and that's why cancer might be still more important for the India, not only India, all over the world. There are many misconceptions about the cancer. The cancer is cancer once diagnosed means the life is cancelled. It's not so. It is a misconception. Now things has changed so fast now and so much development has taken place. Cancer is no more the killer. What is cancer? We should know what is cancer. Cancer is a unlimited, uncontrolled of unwanted cells in the body. That is the basic concept. And it is spreads very fast in the body. That's why the cancer, if we don't make vanish the cancer cells from the body, the death is a result. That's why we have to be aware about it. The misunderstandings is that cancer is not curable. Cancer is a contagious disease. Cancer spreads, is a hereditary disease. Cancer is very costly treatment. It is not so. The correct concepts, what is the status today? Today's status that cancer is a curable disease provided detected early, treated completely, it is a curable disease. Cancer is not a contagious disease, but it is contagious disease because cancer is not caused by germs. It is produced by our own body cells, and that's why it is not contagious also. Except some of the organs, cancer is not hereditary. Ovary, colon, and breast cancer, they are sometimes the genes, defective genes are transferred from the one generation to the other. Rest of the organs, there is no transformation and it is not hereditary at all. So, and many times people used to avoid the cancer treatment because it's very expensive. But friends, it's not so. There are so many schemes, state level schemes, central government schemes, the insurance is there, so many things are there, and the cancer has become a curable disease. So with the free of treatment everywhere available in all the centers in the state and was the center. How many people ask me how many types of cancers are there? Friends, we have many cells in the body, many different cells in the body. As many as different cells in the body, as many as types of the cancer. There are many organs in the body. So as many as organs in the body, so many types of the cancer types are in the body. So that's how there are many types of cancer that we have to handle when diagnosed. Cause is very important. Why we should know basic? If we want to know the future, we should know the present status. The causes are very important. In related products, the alcohol, bad habits, then the diet, where there is a diet which is a spicy, oily diet, outside food, the red food, all these problems in the diet also are causative factors. At the same time, defective genes itself is a cause of the cancer. In defective genes in children, we hear that some of the children get the blood cancer. How they get it? They get it only because their genes are defective. Not always. So that's why that is also one of the cause of the cancer. And the another thing is a lack of exercise. Now the life has become more sophisticated. More services are available. Nobody walks. Nobody runs. That is a problem. Two-wheeler is always available. Nobody do cycling. That is a problem. So exercise is very important. Exercise, lack of exercise is a cause of cancer. Exercise increases our resistance to the diseases, including cancer. And there is a lot of research is going on. So in spite of this also, many causes are still unknown and the research is going on. Maximum research is going on in the world is on cancer. Symptoms. The very important, the primary symptoms of the cancer are very important. One is the caution, is a simple word that we should remember. Any bleeding without any pain from the body, like the mouth, from the anus, from the urinary system, any bleeding from the body is painless bleeding, is the first symptom of the cancer. Then again, any swelling, a painless swelling which is increasing in size, there also is a cause of the primary symptom of the cancer. Many ladies do not come to the doctor unless the swelling is very big, because they say that there is a trauma, the other causes of the swelling in the breast, but cancer comes like a thief in the body. Initially, it doesn't pain at all. Slowly, it went on increasing, and then it comes when causes pain when it is at one stage. So that is not painful. Swelling, increasing in size, bleeding from the various places without any pain, loss of weight, and these are the all many symptoms of the cancer where we should be aware about that, and we uh, see that the patient when comes to us, we should clinically examine and decide about the cancer. There is a persistent cough is there, breathlessness is there, loss of appetite is there. So many things about the cancer depends upon the site of cancer and depends upon the organ involved cancer. The sites affected by the habits, tobacco, many organs in the body is affected, not only the oral cavity, but head and neck, our esophagus, stomach, intestines, everything is affected by the tobacco. Next slide. With the alcohol affects many organs in the body, not only the brain, but the other organs in the body also is affected, like stomach, liver, pancreas, and brain. The primary checkup is very important, and that's how my colleagues should be aware about that. In future, this is going to be very important. The screening of the cancer. Screening is early checkup. Sometimes even without any symptoms. Symptomatic patient who comes to us should be done immediately all the screening tests. But other patients who has a family history of breast, cancer of the breast, cancer of the ovary, cancer of the colon, should be done a screening and examination of the base of the body. At the same time, everybody about the 30 years should do a yearly screening, yearly regular checkup from our doctor. Self-examination of the breast in female is very important because 99% of the cancer breast comes in the female, 1% in the male. So self-examination also is important. Diagnosis important in malignancy. Diagnosis, clinical examination in future also is going to remain. Clinical examination today important, in future also is going to important. So we will be aware about how to examine the cancer patients. In cancer, the main treatment part is cancer surgery, cancer chemotherapy, and cancer radiation. They are the basics, and in future going to be remain the basic treatment in the cancer. And it's a holistic approach where the family doctor, the different consultants together, they see the patient, they treat the patient, and then the result is there. So holistic approach, a teamwork is needed in treatment of the cancer. Now the thing that changed from the clinical based medicine to evidence-based medicine. In clinical-based medicine, so clinically we used to check and then decide. Now in evidence-based medicine, we need an evidence like cellular evidence, pathological evidence, and the diagnostic, other imaging evidence. Everything is done. So the staging is much more proper than before, and specific treatment is given accordingly. Cancer surgery is the primary treatment for the stage 1 and 2. There are different stages in the cancer, first, second, third, fourth. First and second primary treatment given is the cancer surgery. If it advanced stage, we give the down staging of the cancer tumor by giving the chemotherapy and then do the surgery. What is the future? Open surgery is going to remain in future, but more conservative, saving the functions of the organ. And secondly, laparoscopic surgery, endoscopic surgery, and now the robot has come. The robot has taken place. Now it is coming many places in the world and in India also. The robot is taking over surgery, and artificial intelligence also being used in the robot. This is the present where the open surgery is done. This is the robotic surgery where the machine is used to remove cancer tumor. And this is also, what is the robot? Is a master slave model where the surgeon sits on the console and he operates the machine, and accordingly the tumor is handled and removed from the body. Chemotherapy, another important treatment in the cancer. Chemotherapy is reduces. Chemotherapy the helps for the primary disease as well as disease which has spread, that is a metastatic disease, important, and kills the visible and moving cancer cells in the body even after the operation. After surgery also chemotherapy given. In radiation also, along with radiation, chemotherapy also given because it increases the effect of the radiation. In the future lies in the chemotherapies or new drugs are there with the less side effects and more effects. And then we have the immunotherapy has come up, which is medicines are come up like pembrolizumab is used for the melanoma and lung cancer. And we also have the targeted therapy now, trastuzumab used, for example, in the cancer of the breast. So these are the future, and more specific drugs are coming with the less side effects and more effects. The vaccine is there. Presently, only one vaccine is there for the cervical cancer, where the 70% of the cancer we can prevent, but not all. And in future, so much research is going on. In future, might more vaccines come to prevent the cancer against the antibodies. The CAR T cell therapy also is important and has come, but not practically possible now everywhere. But CAR T cell therapy is used in the hematological malignancies like blood cancer malignancies, and used where the T cell is produces antibody in the body. So T cells are removed from the patient's body, they are grown externally, and antibodies produced and then re-injected in the patient's body, so they kill the cancer cell. That's how the CAR T cell therapy is given. The cancer immunotherapy going to play a very important role in producing the cancer vaccines also, and immuno checkpoint inhibitors also are produced by the immunotherapy. So it is going to be very vast, and in future it depends on that, and it will guide us in the future also. Radiotherapy, another important treatment in the cancer cells. It's useful for all the primary tumor and also for the metastatic. Radiotherapy is what? They are used the X-rays, the rays, to kill the cancer cells. And we have the linear accelerator now used anywhere, everywhere, with a lot of facilities in that, like a 3D CRT, MIRT, IGRT, and VMAT and electron beam therapy. But in future, what is going to come is the tomotherapy, where the slice-based radiation is given. And then again is a proton beam therapy, where the protons are used. In linear accelerator, the electrons are used. There the protons are used, and the proton remains in the tumor. The other rays, the X-rays, goes away from the body, but proton remains in the tumor and affects the cure of the cancer better. This is the linear accelerator. So do it the first time. Initial investigation, initial treatment, initial discussion is very important. When patient gets the right advice at the first time is very important. Prevention is very important because we have a primary prevention and we have a secondary prevention. What is primary prevention is avoid cancer to happen in the body. That is a primary prevention. My secondary prevention is that is a early detection. If you detect the cancer early, it is treatable, completely curable disease. So that's why the secondary prevention also is important and it is in vogue. But in future, it much more increased because of the awareness has to create. We have to create awareness in the public so that the primary and secondary prevention will be effective in early diagnosis and also preventing the cancer. So what is primary prevention? Stop all the vices, stop all the proper diet, have a proper diet, regular exercises, regular yearly checkup, and whenever in females vaccine is available, HPV vaccine from 9 to 45 years we can give it to prevent the cervical cancer. That is the only vaccine available at present, but in future we might get more vaccines. This is the example of the 7-time world winner who is a Lance Armstrong, who is a cured cancer patient. So I tell the patients and everyone that never fear the cancer, but to fight the cancer so that we can be successful in life. This is our team of the cancer team. We working together. Together we can and together we will. Definitely this awareness is important. If we have an innovation and if you have a dialogue, definitely we will do a success in the future all together. The future of my youngsters is that have a discipline in life, have a determination, and have a dedication in life. It's very important that these three things, once you decide something, discipline life is very useful for us, because then we can track it correctly. Secondly, determination, what we want to do, we should decide. All the people, they can track on that, and then the devotion is needed to carry out our determination. It's like Mahabharata. Everyone has a Mahabharata in their body. The Mahabharata, what Mahabharata taught us, that the Mahabharata king Dhritarashtra was a blind king. And in our body, what is a blind king? Our own brain. He doesn't see anything. His senses, whatever senses he gets, he knows what is happening. Now that's why. But how he took the wrong decisions? Like 100 Kauravas. What are 100 Kauravas? Is negative thinking. The negative thinking gives the wrong message to the king, that is our brain, and the negative decisions are taken. But what we need to fight this negative thinking and the Kauravas are the 5 Pandavas. 5 Pandavas in our body, 5 senses. These 5 senses do excellent job. What they see and what is the true fact is there, they realize and they inform the brain, and accordingly decisions are taken. So we need 5 Pandavas to fight the Kauravas, but at the same time we needed Draupadi. What is Draupadi? A passion and a purpose. If you have a good passion, if you have a nice purpose, naturally all the 5 senses, all the Pandavas will do work and fight the Kauravas accordingly. That was happened in the Mahabharata. Similarly, we will follow, and we need also Krishna. What is Krishna? Krishna is a Sarathi. That is a guide, a conscience. Our conscience is very important. That tells us what is correct, what is incorrect, what is good, what is bad, and that conscience takes us to the next success in our life. But never forget the Karna. Karna is the elder brother of Pandava, but he went on the wrong side and he died. What is Karna in our life? Our body? It is the ego. The ego is very harmful. Whatever the success people want in the personal life or professional life, the ego comes in the way and the person doesn't become successful. That's how we should keep away the Karna from our body, and we will be successful. And I hope you will be successful in life and throughout. Thank you very much.